Together we achieve victory over heart failure.
Yeah, good evening. I am Dr. Shashank Dixit. I am consultant interventional cardiologist and director of Spandan Hospital, Bhopal. And today we are here to discuss about a very important topic, that is victory over heart failure. As we know that we are now facing an epidemic of non-communicable diseases such as diabetes, hypertension, and heart diseases. So, as a sequelae to heart diseases and heart attacks, we have this problem of heart failure. Heart failure is basically the problem in which the pumping capacity or the efficiency of the heart gets reduced to a remarkable degree so that it is not able to pump the blood in the whole body. As we know that our heart is a pump in the body which circulates or pumps the blood in whole of the body to each and every organ. So it is very important to understand that what are the causes of heart failure. So by and large, we see that heart failure is common in patients who are diabetic, who are hypertensive, who have kidney disease, who have more propensity or more chances of having a heart attack. So when the heart attack occurs, there is some reduction in the ejection fraction, and that results in heart failure. So another, apart from these causes, some other causes are due to some viral diseases. As we know, we 2 years back we have the corona epidemic and other viral diseases, other infections, which lead to reduction in the ejection fraction of the heart, which we known as myocarditis. In these kind of cases, we also see heart failure. Other causes, the congenital heart disease. Sometimes we have defect in the heart, in the structure like VSD, ASD, and as their long-term sequelae, we see the patients of heart failure. Similarly, we have very high incidence prevalence. I will not say incidence because incidence is reducing. So prevalence of rheumatic heart disease was also high. So in the valvular heart disease also, we see heart failure. Also with some toxins and reduction in the heart pumping because of some drugs and toxins or pregnancy induced. These are rare causes, but we also see. But by and large, the most common cause are the diabetes, hypertension, and secondary to myocardial infarction. So after knowing that what are the causes and what are the patients who are at risk of heart failure, we should also understand that what are the symptoms of heart failure. So the most common and most important symptom of heart failure is the early fatigability. Like the patient will say that earlier I used to do this much of task, but with time I am not able to do this task. I am not able to climb two stairs, or cannot walk uphill, or cannot perform my day-to-day routine activities. So this is the most common and alarming symptom, and you should be very cautious if you are diabetic, hypertensive, or other illness, that you should take note of that. Second is that sometimes people have difficulty in lying down position, that is also called as orthopnea, or they feel that air hunger in the night, that is also called as paroxysmal nocturnal dyspnea, or sometimes they have signs of volume overload like edema in the feet, swelling in the feet. So these are also signs of heart failure. So if somebody has these kind of symptoms, then he should definitely consult a physician or a cardiologist so that he can take note of that he can examine that. And after examination, he'll ask you to undergo some tests. These are basic tests like ECG, echo, NT-proBNP, other blood parameters like if you're diabetic, then your sugar and renal parameters and liver parameters. He will ask for these. And once it is diagnosed that you are suffering from heart failure or your pumping capacity is not up to the mark, then he might ask you for sometimes if it is very severe for hospitalization or for some further tests like angiography or some pacemaker or ICD, CRTD, that is also there, or LBSs decide depending upon the severity of the symptom. So very important is to be aware of that I am having a heart failure or I am having some heart disease, so I have to be more careful. So this is about those who have heart failure. Now, if the patient is diagnosed heart failure and he is regularly following and is regularly visiting the OPD, so some important parameters is that you should be aware is that his weight should not increase by much. The water intake should be limited. Doctors will tell you that it can be 1.5 liters to 2 liters depending upon the weather. And he should avoid heavy exercise. He should take regular medicines. He should take diabetes medicines and other medicines if there is any other illness. And by taking care, the patient can be remain symptom free, and the longevity and the morbidity and mortality. Thank you for your patient listening.